I am a pre-diabetic and I am low T. Now I take a testosterone shot of 0.55 milliliters twice a week. My concern is this: doesn't testosterone raise blood sugar? If so, is it still safe to continue to take testosterone therapy, or can it make my blood sugar A1C and discontinue the therapy?
Okay, again, I'd love some more context, like age. How long has he been a type 2 diabetic? What's his A1C? You know, when did he start his testosterone? How's it being managed? What other ancillary medications you use? There's a lot more here, but I'm just going to try to just touch on this in a general statement. Most type 2 diabetes in adult males, outside of those that obviously lead a poor lifestyle nutritionally and activity-wise, manifests as a result of low testosterone. Testosterone helps to regulate metabolism, which then also aromatizes into estrogen, and estrogen has been shown in studies to actually regulate blood glucose levels. So I would argue that testosterone therapy done right, and that's a key point with an asterisk, and I'll come back to that, but testosterone therapy done right can help to arrest and reverse insulin resistance or type 2 diabetes, actually lower your A1C. Now, here's my concern. This is a gentleman who is on 220 milligrams per week, which is a fairly hefty dose for most guys. I find most of our guys between 100 and 160 milligrams a week, split depending on their SHBG level, 2 to 3 times per week on average, is really a sweet spot for getting the therapeutic benefits of treatment without the side effects. Now, when you have someone who's admittedly a type 2 diabetic, we don't know what this guy looks like, but generally speaking, other metabolic syndrome ailments come with that, like obesity and various other things, hypertension, hyperlipidemia. Now, these are things that could be exacerbated with elevated testosterone levels, increased appetite, increased hypertension from hypervolemia. So there's a lot of things that taking too much testosterone can make worse. It's not going to make your diabetes worse, but secondary to the other things, your diabetes could become worse. So I would urge you to have a very close look at your therapy and have a conversation with your provider who's treating you, and make sure that they truly understand the implications of managing testosterone for men.